Hello, I'm Roxanne Wilson, and I'd like to welcome Tim Dehne, Green Party nominee for House District 17. Thank you for joining us.
Well, thanks for having me. I'm really excited about this opportunity because, we're all getting used to this technology, and I've been on a lot of Zoom meetings, but this is my first
Yes,
Skype.
I'm kind of a rookie when it comes to Skype myself. So I was wondering if you can tell us about your positions and your experience that would encourage a senior or a person with disabilities to vote for you.
Well, I've been, like I say, I've been involved really in senior and disabled services for, basically since I finished high school. I was in healthcare administration at OSU until I dropped out to concentrate on my own health. And I've worked at numerous nursing homes in various capacities, and I've worked for home health agencies, and I've been a friend, a friend to quite a number of elderly and disabled folks over the years, and so I bring a perspective of observation and study to the process. And also, I think an important, valuable part of my running as a Green is I'm not part of the current dynamic in this country, which is, I think, brought us to this crisis that we're at right now. I mean, we know we have a mental health crisis in Oregon. Oregon lags behind in mental health services. We have an aging population. How do we keep up with the needs that they have? So I'm just happy to be here, and I think I'll provide a valuable aspect to y'all, to the NWSDS work as a legislator.
The Oregon Project Independence, or OPI, is a cost-effective program that keeps seniors and people with disabilities in their home. And yet every year proposed funding for OPI is significantly cut. If elected, could you tell us what you would do to protect funding for OPI?
Well, I think I would definitely fight for the funding for OPI. I experienced that myself in a number of cases. Well, thinking of my aunt that helped raise me. I didn't have a father growing up, and my aunt helped raise me. And then as she aged, she was, definitely wanting to stay in her home. And we tried to accommodate that as best we could until really she was no longer able to stay in her home. And that was sad. And maybe we didn't do a good enough job, my sister and I refer to, and my mother. But then my mother, as she aged, she also had to, well, she found her own way, essentially. But so many issues are brought up in thinking about my mother and my aunt's situations in life. Leads me to think that I will do everything I can to improve funding for senior and disabled services.
Thank you, Tim. How would you prioritize state funding, including funding that is matched with federal funds like Medicaid, for services to an increasing senior and people with disabilities population?
Well, I need to get into the legislature really to see how it's all going, and follow the trail. You got to follow the money, and I think that with new awarenesses, and I think with this the whole social networking through the computer could improve things so that people can participate and not necessarily have to travel to be there. So, I'll be looking at, and will definitely be looking at how the money flows into the state and then how it's utilized within the state, because as I say, senior and disabled are our most vulnerable populations, and we have to do whatever we can to care for them.
Thank you, Tim. During this time of increased risk of homelessness, but yeah, hopelessness too, and food insecurities, what will you do on a state level so that seniors and people with disabilities no longer face a lack of accessible, affordable housing and receive appropriate nutrition?
Well, actually, that'll probably be a focus of mine is nutrition. And as far as people getting uh, uh, good nutrition, not just calories, but, you know, the 90 essential nutrients, vitamins, minerals, and enzymes, and everything that we need to improve and improve our immune systems. The immune system is what protects us from viruses such as COVID-19. And I'm not hearing enough focus on that in the media about the great need for everybody to focus on their own health. When I was at Lynn Benton Community College the first time, I put on a health forum, which I called Your Health is Your Wealth If You're Wise. And I'm not seeing a lot of wisdom out there. And I don't know where they're being educated. But we do know that we have a lot of addiction problems. And addictions lead to poor nutrition and bad outcomes. And so I will just be concentrating my efforts to improve nutrition. And it may be that, you know, some things needs to be changed, some needs to be kept the same. But anyway, I'll be focused on the problem, because I think this is one of our biggest problems, is that we do not take care of ourselves and improve our immune systems.
True. Thank you, Tim. What are your plans to improve the health of vulnerable seniors and people with disabilities, including people of color, who traditionally suffer more from health disparities due to pre-existing conditions?
Well, I guess two things are education. Education is most important, so they have to be educated. And sometimes it's difficult to educate them because they're locked into a mindset that keeps them from accepting new ideas that could improve their health. So it's a tough call. It's a tough road. And BIPOC, if you may know, stands for Black, Indigenous, People of Color. And there's a strong group up in Portland area. But like I say, I will be reaching out to all communities, no matter which community you're in. And I think I have connections throughout the state with a number of communities, such as the Grange, which is on my shirt here, and Oddfellows, which remains a fairly sizable community within Oregon, NAACP, which is a growing community in Oregon, and increased awareness of Black, Indigenous, LGBTQ, A+ communities. And so I plan to have the state actually listening to them.
That's wonderful. Thank you, Tim. I really appreciate you being here with us today.
Thank you.
Once again, thank you. Once again, this is Tim Dehne, Green Party nominee for House District 17. Thank you, Tim.
Well, thank you very much. Did we go through all 5 questions already? It seemed to fly.
Yes, I think we did it.
Okay.